Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
Hello viewers, welcome to this week's episode on Health Watch. I am Angela Mweze. According to the United Nations, Nigeria has the 7th largest population in the world with over 200 million people. It also predicted that by 2050, at our growth rate, if no strict measures are taken, we will rise to become the 3rd highest in the world with a population of over 400 million. This means by 2050, we will have produced an additional 200 million people. The Nigerian government had foreseen a population crisis almost a decade ago and identified family planning as a technique to slow down the growing population and reduce the high maternal and child mortality rate. The country, however, failed to meet a global pledge it made along other countries in 2012 to achieve a modern contraceptive prevalence rate, that's the MCPR, of 27% among all women by 2020. This means that Nigeria made a pledge that by 2020, 27% of women of childbearing age will be using some type of modern contraceptive successfully. At the close of the deadline, FP 2020 target indicators show that Nigeria currently has met only 13.9% MCPR for all women. Now, this means that 1 in 4 married women aged 15 to 49 still has an unmet need for modern contraception. It also indicates that about 15.7 million sexually active women in Nigeria who want to avoid pregnancy as well as sexually transmitted diseases will still find it very difficult to do so. Now, why this increasing population is not such good news? Just in case you're happy that we're obeying the Bible to go ye and multiply and fill the earth. Our population growth rate as at 2020 was 2.58%, while our GDP rate in the first quarter of 2020 was 1.87%. Now, to put it simple, we are producing more children than we are producing what is required to take care of them. To me, this is not really exciting news. There is obviously a need to control population growth and invariably reduce maternal and infant mortality. And one effective tool to ensure control of population growth is what we're going to be talking about today on the program. Our discussion today is on family planning. We have a lot to learn today. My guest on the program is Dr. Nathaniel Adewale. He is a consultant gynecologist at the University of Abuja Teaching Hospital. You're welcome to the program, sir.
Thank you very much.
Yeah. So, but don't forget, you can send in your questions, advert placement, or how to sponsor this program to the contact showing on your screen. You're welcome to the program. Thank you for coming, and it's good to have you. Now, we have read all about family planning, the indices and the fact that family planning is an effective tool to control population growth. But from a professional angle, let's see, what exactly is family planning? And on this program, we want our viewers to understand the concept of family planning. We want to disabuse their mind on any wrong notion on family planning. Okay.
No, there is this wrong notion that once they mention family planning, it's about, oh, they want to control us, they want to limit the number of children we can have. But the primary goal is actually for a couple to be able to have the ability to control the number of children they want to have, the time they want to have it, and the spacing of those children, which is critical for healthy life of the woman, of the children they bring forth. So it's not primarily to control population, but to make sure that those they are able to live an healthy life and they are able to take care of them. Also, family planning helps to prevent unwanted pregnancies.
Okay.
And you know the kind of damage unwanted pregnancy have done in the society. In fact, when it talks in terms of maternal mortality, that's one of the highest contributors.
Okay.
And if young ladies or married couple who are not ready got pregnant and it attempted abortion, which a lot of time is not legalized in the country,
Okay.
and it's illegal, it can become complicated, and a lot of women are dying. But if they are aware and they make use of family planning and contraception, unwanted pregnancy will also be prevented.
Okay.
A lot of women that die will not die. Also, complications that comes from abortions, like later on difficulty in conceiving and other issues will not arise. Okay. So we should look at family planning holistically, not just in terms of maybe they are trying to limit population growth.
Okay, so that's kind of making up, because when you think of family planning, of course, you think in the bigger picture.
Yes.
The government want to make control population and not allow people have as many children as they want to have. But it's important to also note from what you have just said that number one is for families to plan.
Yes.
Let's take that again so that people understand.
For them to have the ability to plan the number of children they want to have.
And they can take care of.
They can take care of.
Okay.
The time they want it.
Okay.
Because you are planning to do something, maybe go ahead with your career, and suddenly children started coming. Can eventually limit career growth and also ability, empowerment to take care of those children. Okay. So to also determine the timing and also the spacing. Because if the children come too early, you deliver one this year, that one has not even been weaned. Another one has come. A child is about 5-6 months. While still breastfeeding, trying to grow. Another pregnancy coming. How with the survival of that one that is just about 6 months, of course, it will affect the growth of that one too. So it also helps the children to be able to grow up in an healthy environment, have adequate care. Also, there is need for the woman to recover from the last delivery.
Okay, now, so that we'll take it one step at the other one, because the first one is, okay, for your family to have the number of children you want to have. So you can say, I want to have only 3 children.
And you have that one.
And then you have 3 children, and then you're good.
That's good.
Then, now, number 2, there's the area of caring for spacing the child, spacing the children.
So that you can have the children can grow up to a level that it can mature before you have the next one. Not having them too frequently. That can affect the growth of the previous ones. Okay,
let me just stay on this particular statement, or this statement you made. That is the growth of another child. You know, some women, you see them carrying one child, and then there's another one in the stomach. How does it begin to affect the child? You know, because some women, when they've taken it, you know, how does it affect children if you don't space them properly?
You know, one of the best way for healthy, both physical and psychological development of a child is actually breast milk.
Okay.
And adequate care.
Yes.
Now, if a woman is pregnant after just about 5-6 months, he has to wean that baby from the breast milk and start artificial feeds.
Okay.
And artificial feeds adds the content, you know, nature has a way that makes the breast milk to give everything a baby needs for proper psychological growth to be in the milk.
Okay.
So once you introduce artificial milk, it has its own limits. Then apart from that, look at our own environment. Can we prepare those artificial milk in the good hygienic environment? No proper water system.
Yes.
So that one can lead to disease in that child again. But if that child has opportunity, for example, to breastfeed for 1 year or even more, the child will be likely to be more healthy, better looking.
Okay, so the way it's affected, so women that have children, maybe after 6 months, you don't have enough time to breastfeed them, to give them the first shot of life they have, which is the breast milk. Okay, so I'm understanding it now. Number one, because why I'm enjoying what you're saying is it's taking my mind off the whole population control thing, and now into more of a family thing. So number one is to make you have the number of children you want to have.
Yes.
Then to help you space the children properly.
Yes.
And then the spacing is important so that every child can get the full, the best nutrients it requires for development. Okay, that's number two.
And let me also add to this. I hope you know the bond between the more the child feeds from the breast milk, the greater the bond.
Bonding, yes.
And you know, the greater the bonding, that's also a form of expression of love. And children that grew up under atmosphere of love are likely to do better, both late in the present and in the future. So we should get that one clear.
Yes.
Then, so we have talked about spacing. Also the timing.
Okay.
Spacing to be able to take the timing. For example, somebody is on the career, you have the first child, you are supposed to go to the next level. If you keep having the children, eventually the career may be truncated.
Yes.
And we are talking about one of the best way for family to avoid all these children being wayward is to empower the women.
Okay.
The time they will be having these children are also the time they are supposed to have their career growth and capacity building. So it also gives the women opportunity.
Okay. To actually advance in their career.
Effective work.
Okay. And then you talked about the women recovery.
Yes.
After I thought you're just okay once you finish giving birth, you can go ahead and have the next one.
Thank you. You know, after about 6 weeks, it takes 6 weeks for at least a certain level for a lot of hormones to have receded and everything. But for other things to return, takes about 6 months to 1 year.
Oh, wow.
Takes about 6 months to 1 year. And during the process of delivery, of the conception, delivery, feeding the fetus when in the womb, breastfeeding, a lot of nutrients are being passed on to the baby. The mother needs to recover.
Okay.
That is why you discover that women who conceive so frequently, they have a lot of other diseases like anemia and pregnancy in their subsequent pregnancy because the blood loss in the last one, all those nutrients have not been adequately replaced. So you need time to build up.
So what's the length of time, the best time in between before the first taking in and the second? How long would you advise?
I would recommend 1.5 years to 2 years.
2 years.
Yes.
But some people are always afraid that if they delay too long, they might not take in a second time.
No, that's not true.
I think that's a myth.
That is a myth.
Yeah.
Though, there are some categories that if somebody is already advanced in age, before you start giving birth, like 35 years when you're having your child at 35, the same advice may not go for the person. But somebody that is young at 20, 21, 22, where are you oriented to?
Okay.
Why don't you make sure this one that you are doing, you do it well? Anything that is worth doing, is worth doing well. Do that first child well. And let the home be ready. Let that baby be ready. When you were introducing, you were mentioning the fact that somebody will be backing one baby. You will still see one backing one baby, another one in the womb. And the one that is even holding in the hand cannot even stand properly. You can imagine you give birth 3 years. That child cannot even walk properly, do so many things properly. Then another 2 years, then you're already pregnant again.
Wow.
So the healthy lifestyle of a family, it also put a lot of psychological pressure and tension on the woman, which they can even transfer to the woman.
Okay. So now it is now beyond, that is really clearer to me now. It's beyond population control. It's actually good for the children. It's good for the women, the mother delivering. Yeah.
And also for the father too.
And for the father.
Because if the woman is not happy under tension, when the man comes home, the reception also will be...
Yeah, we won't be very good.
Yes,
okay.
Working under tension. So the whole atmosphere needs to be a loving environment, conducive environment.
So important thing to note. It's not just it's good for the women.
Yes.
It's good for the child. It's good for the husband.
Yes.
And it's also very good for the community, for the society
at large.
Because we produce better children who who have been brought up in love and, you know, well taken care of.
Yeah.
And healthier children, I believe.
Thank you so
Healthier,
much.
maybe somehow reduce maternal mortality and all of that. Okay, let me pull something out here. Does it have to always be the women that have to be subjected? This is just me thinking like a woman, you know. That's to be said. Because when they talk of family planning, it's always the women, the women. There's nothing the men can do to also control the.
In fact, we are going to talk about methods of family planning.
Yes.
But now that you are bringing this up, let's address the men, because usually by the time we leave it to the end, there's tendency to also forget.
Not to talk about it. Yes.
You know, men, when it comes to family planning, it has to be encompassing. The couple are supposed to discuss on their own, and actually they're supposed to visit the family planning clinic together.
Oh, together.
It's better if they are better, or the two of them are well educated, and they'll be able to make a better informed choice.
Decision, yeah.
Now, let's address some of the methods for the men. One is the fact that if the men are, they'll be able to tell them all the methods that are available. Let's talk about the natural one.
Okay.
Abstinence is difficult.
Yes, of course.
But there are natural methods that are not too effective but are still good. For example, for the man, if the man don't visit a family planning with the wife, they will tell them about ovulation time.
Okay.
Timing of intercourse. Avoiding the fertile period, which is usually around the middle of the cycle, especially people that have regular cycle. That's one. Then another thing is the issue of mechanical means like condoms.
Okay.
And this one is very critical and very important for men to be able to, because it has two advantages. It prevents pregnancy and prevents sexually transmitted diseases.
Okay. Okay.
Especially the younger ones. By the time they use condoms, one, the chances of failure, though, is still there, but it will have reduced the tendency for unwanted pregnancy and the complication of abortions. Issue of abortion. Then secondly, it reduces sexually transmitted disease, and we know there are so many around
there, yeah.
All this gonorrhea, syphilis, the dreaded HIV, AIDS, and others.
Yes.
Hepatitis can also be. So all these ones, so those are the methods that men should be encouraged to be able to use mechanical methods. Then there are other things which we don't talk about. Is the issue of permanent method for women.
Okay.
And that is what we call vasectomy. A man has had about 5, the family has had 5 children. Ironically, the man's own is the easiest and can be most effective.
Okay, okay. Okay, that's the vasectomy.
Yes,
it's
the permanent.
Permanent, okay. That's the man does not produce sperm, or how does that work?
It will produce sperm, but because what we transport the sperm from the testes for ejaculation will have been divided, so the sperm will not be able to come out.
All right, okay, okay.
But I was shocked with what we discovered. Anytime we talk even to men about...
I don't think there's any man...
No, funny enough, men do accept it.
Oh, okay. That's interesting to know.
It will shock you that a lot of times the women that protest more on behalf of the men.
They don't want their husbands to do it.
Yes.
Oh, I thought the women would be jubilating that this is a permanent solution.
You will be shocked. I've seen it not once, not 2, not 3 times.
Oh, wow. Okay.
And their fear is that what if they call the verse
and
during the vasectomy, and the man cannot perform again.
Okay,
but
it's not true. It's obviously not true. Yes.
But we need to really educate. But if the two of them have gone there and they've been told,
yeah. So that's the importance of the couple going, so that it's not just, oh, my wife should go and do it. When she finishes, she should just do it and sort herself out and come home. You know, so it's not the duty of just the wife. It's actually.
And you know, this issue of blaming the woman for everything. The same man will come out during the fertile period, we don't want to hear no. Yeah, when the woman gets pregnant,
he's complaining, why didn't you do what others are doing?
So men, there are methods for men. And I'm happy you brought it out first.
Yes.
So that people should realize there are methods. Simple thing as condom can be very, very effective. Go a long way
in preventing unwanted pregnancy and for control of number of children.
And also timing and the spacing.
Okay, but just to make emphasis. So if you have the vasectomy for the men, you're still fine. You can still have your normal erection. You can still have sexual intercourse with your wife.
And under more relaxed condition.
Okay, without being afraid
without
of...
tension.
No
And tension can even reduce chance of erection or sustainable. But you are under more relaxed about, you know that I won't be able to... I'm not afraid for my wife to get pregnant again. Okay,
so that is a form of... Because why I really wanted to bring this, why I brought this up first was because, you know, when you... even around me, my family, when you hear family planning, everybody just looks at the woman, that you're the only person that this is your problem, this is a problem for you to deal with, but not for the men. Okay, just to go ahead, now we've settled for the men. So every man watching, it's important to go for family planning with your wife.
Yes,
very important, because that is when you find out, you know, how you can discuss with the doctor on the best method that is good for both of you. And if it happens to be that it will be better for the man, it's a good thing. It's a good deal.
It is.
Go ahead.
It is.
But I really want to know the number of men that would like to take that as...
You'll be shocked.
You'll be shocked. It's amazing that women are telling their husband not to. No, it doesn't affect anything. But
we are also having a wrong impression.
Okay.
Women do some form of family planning.
That's what I'm going to know.
Condom, they use condom a lot.
Okay.
That's a form of contraception.
Because I want to talk about the women now.
Now let's get
because I know women are more for...
But condom, remember the male condom is even more in circulation than even the female condom. So we should get... So it's not that men don't. They're only that now the ones they accept, they don't use it too frequently.
Okay, the female condom.
No, the male condom. Okay. Then secondly, most men will not accept vasectomy. That's
yes.
Now, concerning the woman, what are the other options? One thing is, let me emphasize the most natural and most effective form of family planning, and that's breastfeeding.
Oh, okay.
Yes, breastfeeding actually is a form of family contraception, a form of family planning.
So God already gave us a natural...
It's a natural method.
Yeah,
That was why in the olden days, you will see that as if they space their children.
Yeah, I was just going to ask that question. Because now we're doing something that the older mothers and grandmothers, you see, 2 years, 3 years is balanced.
Because then they do exclusive breastfeeding.
Oh, wow, okay.
And the success rate is high. Yes, it can fail. It's not too
100%. Like nothing is 100%.
The failure rate is high compared to other form of contraception, but it's something that could have gone a long way. So this issue of exclusive breastfeeding for 6 months and continue breastfeeding for 1 to 2 years, for as long as 2 years.
Okay.
It also helps as a form of contraception and reduce unwanted pregnancy. So we should get that one clear. We should encourage women to breastfeed despite the career. Nowadays, there are a lot of crèches close to the workplace, breastfeed frequently. And that is why a lot of them, when they are breastfeeding, they don't even see their menses.
Oh, okay.
They don't see their menses.
That period, okay. Oh, wow.
But those people that use it very frequently, that breastfeed their baby very well.
Very well. So not just, but proper, consistent breastfeeding.
Yes. Okay. The first 6 months, the more the baby does not need any other thing except that breast milk is sufficient to give everything the baby needs. And then, as time goes on, you introduce formula feed. And the longer the baby feed breast milk, the lower the chances of unwanted pregnancy. So that's
one is breastfeeding is one. That's for women now. We're in the women part.
Then the other one is also, we talk about the other natural method, knowing your cycle, the fertile period, immediately after the menstruation. Of course, it could be a safe period. Then the issue of the middle of the period. For example, somebody with a 28-day cycle, from day 10 to day 17 may not be safe. Okay. But day 1 to day 9 could be regarded as safe period. Day 17, day 18 to 28 is also a safe period. The only limitation, or one of the limitations of this is this. Sometimes you can't predict when there will be change in ovulation. When there will be change in ovulation.
That is what I was just going to ask here.
So one has to really be careful. And that's why one needs a definitive form of contraception as time goes on. So it has its drawback, but it's a method that can be used.
But just to ask on that, if a woman knows that her cycle is regular, then she can play that. After trying it for a long time,
Yes.
you know that your cycle is specific, even though things change, environmental factors.
Yes.
Yeah.
Let me give you for the example. First, just like I said, that 20-day cycle, the 10 to the 17 is on safe period. Now, for people that have regular cycle, let's say it's about 32 days, just take note, you are likely to ovulate 14 days to the next menses.
Okay.
So for somebody with 32-day cycle, your ovulation time is likely to be on the 18th day.
All right. Okay. Of course, it changes with.
Yeah.
Okay.
So
okay.
if the menstrual cycle length increases, your time of ovulation is also increased.
Increasing, okay,
If it
of
decreases
course.
to something like 24,
4 days. It's
remember
12
just
day.
remember 14 from
Yeah.
24.
24.
So around the 10th, you're likely to ovulate. And you will not meet, you still remove about 3 days before your ovulation. So for those people with 24-day cycle, their safe period may end by day 7.
Wow.
So that's the limitation of those methods.
But if you don't have a regular period, because I know the people that don't really
Then
have
that
regular,
one
they don't even
is
try it.
difficult to
Yes,
dismantle.
even to figure out. Okay.
But the
okay.
best thing is to do other methods. There are simple methods like the pills.
Okay.
Taking pills every
Pills,
day is
okay.
effective.
Okay.
And they do because of the issue of compliance, challenge of taking drugs every day. Tendency to forget or to be too busy to be at the place where the drugs may be, so can create a high failure rate up to 7-8%. And when you talk in terms of number of women, it's a very high figure. So,
but that the pill. Some people complain that they gain weight when they take the. It's a general complaint. I don't know if you. Of course, you'll be hearing that complaint in the hospital. I started taking. Since I started gaining weight.
Let me just take this one because we are going to go to other methods. Let me take generally hormonal contraceptive methods like the pills, the injectable, the implants. Most women believe that it leads to
weight gain.
So a lot are afraid of it. But the research is equivocal about it. Quite a number of researches have shown that it's not true.
So it's
in fact, I've seen a woman that took the pills for more than 20 years, and after 4 children, I saw at the age of 44, I was shocked. She was still very slim.
So it is the indiscipline of the other women.
It's not
eating
indiscipline.
A lot. Are they eating a lot?
No, it's not indiscipline.
Or what is going on?
Generally, after about 3 kids, at the age of 35, there is middle age spread.
Yes, of course.
So whether you take contraception or not, there's just study almost women. It's a natural phenomenon.
Okay.
Which can be overcome by exercise and also reducing intake. But whether any woman takes or not, just it's something that you can observe. Just observe generally. Women at the age of that 35, 45, and having about 2-3 kids, there's this middle age spread, more fats to be deposited.
Yes.
So that's weight gain is now if they are not taking it, they will attribute it only to the pills or to the injection. So pill is one. Other methods are injectables.
Okay, we'll talk about the injectables. We'll go on a quick break, and when we come back, we'll talk about the injectables, and then we also want to look at the side effects, if there are any side effects of some of these family planning methods or consumables. All right, viewers, we'll be right back.
Worthy by design. On this show, we focus on the journey from girlhood to womanhood and everything in between. You are worthy by design.
Welcome back, viewers. Before we went on the break, we were discussing family planning, and we have learned a lot of family planning. And my guest is still Dr. Nathaniel Adewale. Thank you very much, sir. Of course, you've helped me understand. You've taken my mind off something entirely and brought me to a place of family. And I really like the whole family idea I brought into this discussion. So we were talking about the consumables, wanted to talk about the injectables, we're talking about the different types of family planning. So are the injectables now, the ones that can be injected?
There is the short ones of 2 months, 3 months.
Okay.
Provera and others. The limitation of all this one is the frequency of the injection. But what we encourage more is what we call long-acting reversible contraception.
Okay.
Long-acting reversible contraception. These ones are acts over a long period of time.
Okay. And
once you remove them, or there's need to remove them, you want to conceive, there's immediate return of fertility.
Okay.
This include, I talk of injectable of 2 to 3 months. These are short ones. These are include what we call the implants.
Okay.
There's implanol, which is also a form of injectable, can be form of injectable into the hand, and this one lasts 3 to 5 years.
Oh wow, okay.
3 to 5 years. And once you remove them, there's immediate return to fertility.
Okay.
Then the other ones are the what we call the implants, the IUCD, intrauterine contraceptive devices, whereby you insert it into the uterine cavity.
Okay.
And it will stay there, can stay there for 5 to 8 years.
Wow.
That's why they are called long-acting, 3 to 8 years.
Okay.
So these ones are available.
No, right.
And once they are used, whenever you decide after one, if you change your mind after a year, 2 years, you can still just go remove it in 1 to 2 months. Everything returns back because the hormones return back to level. The way it acts, that it releases minute level of the hormone, which was enough to actually reduce the chances of ovulation.
Okay. All right.
Just micro level. And once you remove it, those micro level will not be released again.
Wow.
Then it's easy. The same thing, there is the IUCD we use now also contains hormones. So most of these things are hormone impregnated.
Okay.
And it acts on principle of reducing chances of ovulation.
Okay. Okay.
Then for the woman, the other permanent method is what something close to that vasectomy, what they call bilateral tubal ligation.
Okay.
Usually for women that has completed their family size.
Okay. Okay.
Once the couple agree, once you have completed your family size, you can just go at the bilateral tubal ligation. Some people have a wrong belief that, look, if you cut your tube, you are no longer a woman. That's not true.
The ligation of the tube is the fallopian tubes, isn't it? Where you the two of them. Okay.
Two sides.
So you cut it off so that egg does not
cut off, not cut the whole tube.
Okay, no, sorry. You ligate it.
You ligate. That's what that means. You clamp it or you clip. There are one that you just apply clip. It will clue the canal.
Yeah, that allows the
sperm to go to the egg, and the fertilized egg to go back to the uterus. Okay. So that the sperm cannot connect.
They don't meet at any point in time.
That's
okay.
So bilateral tubal ligation, that's another. What are the side effects? Almost all hormonal contraceptives, they are similar.
Okay.
Right from it's almost common to pace, the injectable of 2 months, the one of 3, 5 years, and others. And one of it you have mentioned, the fact that people believe that it increases weight, it causes weight gain. But I've said it that researchers have disproved this.
Yeah.
So the fear of weight gain should not be
a factor.
Yes, be a factor. Other things that women may not see their menses, what we call amenorrhea. And ironically, women, even when they are not seeing their menses and they don't want to get pregnant, they get scared whether they are not women again. It is not true. Some will believe that this blood that is not being released is accumulating. I mean, because but it's not true.
It's not true. Okay, now that's a good one to talk about because when people don't see their period, is it when they're taking the
either the pills
or
the
the
injections,
yes. But it works a different routes.
Yeah.
You know, it's not like the eggs are releasing and the blood is piling somewhere.
No. You know, once it takes over the ovulation, the circle that makes the principle of menstruation is this: before the ovulation, the follicle start growing, releasing estrogen.
Yes.
So the endometrial cavity then started growing taller like the grass. When it gets to a certain level, close to time of ovulation, the release progesterone becomes so high.
Okay.
When it becomes so high, that leads to the ovulation.
The release of the
And once the ovulation occurs, if there is no pregnancy, it will shed the endometrium.
Okay.
But when there is all these hormones, it keeps the level of the hormone stable. So that's...
So there's no release of the egg at all.
Yeah, so they keep this rising and falling of the hormone that leads to it just sustain at its constant level. So it's not even being formed, so it's not being released. Not that it's being accumulated there. So that fear should be, people should remove their mind from that.
From that fear.
It's unfounded. Then other thing is irregular bleeding. Sometimes causes spotting. If it's not much, women should not worry.
Okay.
If it's not much, but if it's getting heavy, they should go back to the family planning clinic or see their gynecologist.
That's when they're taking when they are on any of the hormonal drugs. Okay.
You can have spotting.
Okay.
If it's not much, just ignore it. Okay. But if it's causing a lot of bleeding, because it can lead to heavy bleeding too. Okay. But the truth of the matter is the fraction of women that have the heavy bleeding or spotting, they are usually less than 5%.
Oh, okay.
Now people will now take, because one person has experienced bleeding, spread that news around.
Then everybody now thinks that the problem
is this. But I can assure them most of these are less than 5% chance of having it.
Okay.
And the good thing is that even if there is, once there are some that you can just give some little treatment and it will be normal, it will normalize. Okay. You can continue with use of it. There's very few, which may be less than 2% of women, are the one that you may need to remove the method. If it's an implant, remove the implant. If it is IUCD, removing the IUCD. And this procedure, our outpatient will not even take 5 minutes.
For me to do, to do
it.
Okay.
And so that one should not discourage you from using another method. Okay. You may react to, those few people may react to, some may react to, let's say, the implanol, injectable implanol, whereas the IUCD will work for them.
So women should not be afraid to change the method of contraceptive. No. Now I want to talk about side effects of some of these contraceptives. I remember I was speaking to my aunt once, and she said, I can't remember the contraceptive she was on, but she was talking about, problem in her back or something like that. I don't know if it has any relation with it, but she kept on saying that when she takes it, it makes her back pain or blah, blah. So she had to go to the hospital, of course, to get a change. So are there side effects, or is it just...
So all the we have been talking about actually the side effects.
Okay.
Not seeing the menses, spotting, supposedly weight gain, which I've told you that in most cases is not actually the cause. There are some who actually have this excessive bleeding, what we call menorrhagia. No, those who that complain of back pain or easy of fullness. But these are something minor. Remember, at that age, some of them are around 40. Naturally, all this arthritis and other things can crop in normally. So primarily, it may not even something like back pain. It's not likely that it's even the contraceptive method
that is responsible
for it. It's just ache.
Whether
the person used it or not, those kind of back pain might have been there before.
So it's not really about
yes, but that's kind of the spotting, the irregular bleeding, the nursing menses, heavy menses, in very few of them could be from that, from the contraceptive method.
I just want to clear something, because I was reading it, there was a page that they talked about this family planning, and I was surprised at the arguments people were bringing up and comparing family planning to abortion. I was really, I never thought of it that way. preventing pregnancy means either somehow you're getting rid of the child somehow. Maybe with this idea you were saying that the blood is piling up somewhere since you're not seeing your period, then the blood is piling up somewhere. Maybe that's what the person is thinking. But can you just help us dispel that notion, that misconception? If it is actually.
Yes, how can you abort something that has not started? Remember, most of them, especially hormonal contraceptives, we say it will not allow ovulation. That means it will not allow release of the egg.
Okay.
So if the eggs are not released, how can you form the baby in the first instance?
Yeah.
Then the other one they can actually is another form of family planning that people think is what you call emergency contraception. The person had intercourse, then immediately after the person takes pills. There are pills that are designed to be taken within 24 hours.
Okay.
To ensure that unplanned intercourse does not lead to pregnancy.
All right.
Remember, most of the time it has not even fertilized.
Of course, yes.
But by the time you take the pills, the person can now start bleeding before the normal time. That's why they think it's some people have that conception. But it has not even formed. Only that it altered the normal pattern of what we call the proliferative phase. The secretive phase.
Okay.
Because we have the proliferative and the secretive phase.
Okay.
So by the time you take that drug, it changes the phase, can make the phase to come earlier. Even emergency contraception, the baby will not have been formed by that time. The only one that people may think that if after conception somebody take drugs to, yes, that one, but that's not even a form of family. That's not what we talk about family planning.
So it's completely different from the
It's
whole concept of
different.
abortion. Abortion is the child has been formed, and then
even if it's a fetus,
okay,
and then you are not taking something to get rid of it. To
get rid of the child. Yeah. Okay, so now just for advice and for emphasis, within what age, because we're wrapping up now, but within what age would you advise a lady to be having children? What's the advisable best age to have children as an experienced person?
Let me say this, don't let me be too absolute, but we should avoid teenage pregnancy.
Okay.
Before 18, a woman is still growing. The bones has not fully developed.
Wow.
So we should avoid teenage pregnancy before 18.
So before 18 is not advisable.
It's not advisable.
Not advisable.
And that's why you see a lot of women when they get pregnant before then, or the issue of difficulty in delivery, VVF, especially if the labor is not well managed, can result. That's why a woman admitted before 18 deliver a baby that is average weight, but because the pelvis is not well fully developed, it resulted into operation. The next one, when the one has grown to adult, we should be able to deliver by ourselves. So we should avoid teenage pregnancy. Okay. But for my opinion, since you've asked that question, I will say 22.
Okay.
It's
optimal. It's an ideal age.
It's an ideal age, 22.
Okay.
That's my opinion, since you have asked for
your opinion. Okay.
But we should run away from as much as possible is teenage pregnancy, and that's below 18 years.
Below 18 years.
So that it can give the room for the proper growth of the pelvis, so that a child will not be nursing a child.
Exactly, because even mentally, the person might not be.
If you remember, Child Rights Act limits anybody below 8 is still a child.
Yes.
So a 50-year-old, so who is the baby there?
Still a baby. Okay, so far, what has the response been like in the hospital from people coming, over your years of, working with women and men, as a gynecologist over the year? What is the experience? Are you having more people coming to take the number? Just before we even answer that question, these consumables, are they free, or you pay for them, or how does it work?
One thing about most of them are highly subsidized.
Okay, highly subsidized.
By international organizations.
Okay.
But I think it's sad that we don't own most of this program. We should be able to fund family planning within the country, within ourselves. Because right now, the acceptance is higher because it's almost free.
Yeah.
In fact, apart from maybe pay token for consumable, all the drugs are free.
Wow.
In most of the family planning center, and it's being formed by international organization. The limitation of this is that it needs to be sustainable. And that's why us owning as a government, Nigerian as a policy, owning the program, making it readily available everywhere, and also building the capacity to go to the interior villages.
Because those are people that don't even know
they may not even have access. You are talking about unmet need. We still have less than 20%.
We still have less than 20, of course, yeah.
So that's which population of Nigeria do not even have access. So we have a long way to go. One, to put enough resources there to build the capacity, and I'm happy we need more sensitization.
Yes, on the issue
at the grassroots level, like the kind of sensitization that was given to HIV and Ebola.
Yeah.
That one will help to drive the message home. So that more people can get aware and they are accept. But generally there is increase.
Yeah.
And also one thing I also noticed recently, like that long-acting reversible contraception, like the implant, the IUCD, this gaining more popularity now.
Okay.
Those fear of old are not there so much again.
It's been dispelled.
But we need to also, another thing, let me emphasize, is what you started with. We need to include men participation in family planning decisions, educating them, getting across to them.
Yeah.
If it may go to religious houses, places of work, let's get this message out to people. Some men believe that if my wife did family planning, can make her to become promiscuous. Still a lot of wrong concepts. So there is one area that is still we need to work hard on, how to reach the male population.
Yeah, male population. So family planning is not just for population control, but it's to help the family.
Yes.
Establish that.
But that's a primary goal.
That's the primary goal, to help the family and to help you have control. You have some form of control on the number of kids you have, so that you don't have.
Yes.
The economy is not the easiest now to have so many kids to start.
I think if contraceptive rates become higher and more people accept it, most of this kind of about unwanted pregnancies.
Yeah.
It has made a lot of people to drop out of school. A lot of young girls have ruined a lot of career. Some have lost their reproductive career because of abortion becoming complicated. It's not legalized. They do it with quack, become complicated. Either their two become blocks or they lose even their womb.
Wow.
Reproductive career damaged. But if these young ones have learned about family planning, this one will not. We should not be afraid. We need to be more open. Let mothers teach their children. If you don't teach them, they will learn it the wrong way.
Maybe she even be included in marriage counseling in churches.
No, that one is late now.
No, you can tell them in the beginning, but it can be included. We have to start even
from secondary school level.
From secondary school to teach about.
It's a fact that we need to come to reality about.
So education about family planning is very important.
Critical.
It's critical.
More awareness, and I will encourage all the media houses, just like they do jingles for HIV and Ebola, if they can increase their airtime for family planning to help to drive the message home.
Wow. Well, we've been talking for a while now. Thank you very much for coming on the program today. I'm still going to invite you back. We're going to talk on maternal health, maternal health, and child health. We'll talk about even the concept of childbirth, giving birth, the methods of childbirth. We're still going to come back and talk about it. So I'm going to have you back on the program. Thank you very much for joining me on the program. It's been an awesome time, and I've learned a lot. In fact, my mind has been changed from the whole concept of family planning. Thank you very much, sir.
I've learned from you too. Thank you.
Thank you very much, sir. All right. Thank you, viewers, for watching and hanging on with us all this while we've been talking about family planning. But I know that the fact has been established. Please, it's not for just the women. Family planning is not just for women. It's for both men, for husbands and wives to work together to achieve a goal, and that is to plan a family that you can take care of. Thank you for joining me. I've been speaking with Dr. Nathaniel Adewale. He's a consultant gynecologist at the University of Abuja Teaching Hospital. I'll see you next time. I am Angela Wenze. Goodbye.